And now for today's episode, we will be answering the cardiovascular disorders, which will be consisting of two parts. So without further ado, let's start. Now for the first question, a client with hypertension is being treated with metoprolol, hydrochlorothiazide, and captopril. Other scheduled medications include docusate and the multivitamin. The client's current BP is 124/86 mm mercury and pulse rate is 48. Which scheduled medication doses should the nurse administer? Select all that apply. Now for this question, as you can see on the choices below, it talks about medication that is suitable for the vital sign of the patient. So you must have the common knowledge for the side effects of these medications. Now for the choices below, look at letter A. The metoprolol, it is a beta blocker, which means it has the ability to decrease the heart rate. And as you can see, the client's heart rate is bradycardic. So if you give this patient a beta blocker, his bradycardic status will be worsened. The dose of this medication should be withheld. So letter A is not included. Now for letter B and letter C, the captopril and the hydrochlorothiazide, these medications does not lower the heart rate and may be safely administered to maintain control of the hypertension.
Yeah!
So letter B and letter C are included. Now look at letter D. This medication is a stool softener and may be safely administered to the client. And always remember, straining at stool could cause the client to use Valsalva maneuver, which could temporarily lower the heart rate further. So, it is advisable to give stool softener to the patient. So letter D is also included. Now for the multivitamins, actually it would not adversely affect the client's pulse rate and may be safely administered. So it is also included.
Oh, come on.
Now the final answer is letter B, C, D, and E. Now for the next question, the nurse has finished reviewing the shift report on a cardiac unit. The nurse should plan to see which assigned client first.
Oh, come on.
Okay, this question talks about prioritization. And when we say prioritization, it is who to see first among the rest.
Duh.
And always remember the rule of ABC, the airway, breathing, and the circulation. Now, among the choices below, look at letter B. A client who is ambulating for the first time is not a priority because the client does not have any emergent situation that is need to be attended. So letter B is a no-no. The next is letter D. Though the temperature is increased, it is not that priority but it requires additional assessment. So letter D is also wrong. Now between the two, as you can see, both of them have the problem of the airway, which is dyspnea. But take note, patient with hypertrophic cardiomyopathy is expected to have this symptom. Because dyspnea is a chronic symptom with hypertrophic cardiomyopathy, which also requires assessment. That is why we are left with the final answer, which is letter C. Because a client with endocarditis is at risk for thrombus formation. And also take note that chest pain and anxiety are signs of pulmonary embolism, which is a life-threatening complication that requires immediate attention. So that is the final answer. Now for the next question, the nurse is discharging to home a client with a new diagnosis of atrial fibrillation. The nurse should explain that onset of which symptom is most important to report to the healthcare provider. So according to this question, we must know which symptom of atrial fibrillation that is very alarming and the most important to report to the healthcare provider. So among the four, what do you think the answer?
Come on.
If you answered letter A, You are wrong, because irregular pulse is expected with atrial fibrillation. And also fatigue is not included because fatigue may accompany atrial fibrillation in some individuals, so it is already expected.
No, sir!
So among the two, if you answered hemoptysis, you are correct. Though fever could be dangerous because it could be a sign of illness that could increase the workload of the heart, but it is not associated with atrial fibrillation, and it is not necessarily included in the discharge teaching. That is why fever is just the second most important item to be reported. That is why the final answer is hemoptysis, which is one of the common symptoms of pulmonary embolism. And any symptom of pulmonary embolism would be important to report immediately. So that's it. Now for the next question, the nurse is caring for a client with a history of renal failure and a new myocardial infarction. The nurse who is reviewing laboratory findings should call the healthcare provider to report which result. Now for this question, we are searching for an abnormal value that is very alarming to a patient with a myocardial infarction. So you must know the normal value of these following. So among the four choices, if you answered potassium or sodium, you are already wrong. Because remember, the normal value of potassium is 3.5 to 5.5, or some books says 3.5 to 5.0. Though it is kind of high, but it is in the normal range. While in sodium, normal value is 135 to 145. It is still on the normal range. Now just by looking the remaining two, if you don't know the normal value of digoxin level, it is 0.5 to 2.0. So the given is also normal. While the remaining calcium has an abnormal value because the normal range of it is 8.5 to 10.5. And as you can see, renal failure is a common cause of hypocalcemia, and the value of 7.0 mg per dl is below the normal range. So letter C is the final answer. Now let's proceed for the next question. The nurse is caring for a client who had a permanent pacemaker inserted because of a complete heart block. The nurse determines that which client outcomes indicate a successful procedure.
Oh no!
So in this question, permanent pacemaker is given when the patient have a complete heart block. And among the four choices, the indication for a successful procedure is... If you answered letter A, you are wrong. Yup. If you thought that is the answer, you are wrong because the client is not allowed to ambulate for the first 24 hours to prevent dislodging of the electrodes. So in letter A, the client is ambulating within the 4 hours. But always remember that the patient is not allowed to ambulate within the 24 hours. So that's wrong. Now among the three choices, if you answered either B or C, you are also wrong. Because always remember that normal sinus rhythm does not reflect pacemaker function. Also, pulse and BP does not reflect pacemaker function.
Come on!
That is why you are left with the final answer, which is letter D. Paced beats indicate that the pacemaker is functioning. That is why a paced beat is an indication of a successful procedure. Now for the next question. The nurse is caring for a client with a diagnosis of aortic stenosis who has surgery scheduled in 2 weeks. The client reports episodes of angina and passing out recently at home. What would the nurse's best explanation about recommended activity at this time? So in this question, it mainly talks about patient with aortic stenosis and its recommended activity. So among the 4 choices, the nurse may say, what best explanation? So always remember that when we have a patient with aortic stenosis, we must give them activities that is prudent to decrease the strain on the heart. That's why letter B is incorrect because the client should not take short walks at this time because it can cause a strain on the heart. While also look at letter D, the client should not attempt to increase activity preoperatively to build stamina. Look at also letter C. Activity restrictions are recommended to reduce myocardial oxygen consumption. So letter C is also wrong. So the correct answer is letter A because symptomatic aortic stenosis has a poor prognosis without surgery. Restricting activity limits myocardial oxygen consumption. Since the incidence of sudden death is high in this population, it is prudent to decrease the strain on the heart. That's why letter A is the final answer. Now for the next question, a client who has just undergone cardiac angiography has a catheter insertion site that has no bleeding or hematoma. Vital signs and distal pulses remain normal and intravenous fluids have been discontinued. The client refuses any food or fluids and asks the nurse to be left alone to rest. What is the nurse's best response? So in this question, it talks about a client who has just undergone a cardiac angiography. So what do you think among the four choices is best given to the patient? Now if you answered letter D, leg exercises are not recommended because exercise could disrupt the clot that form at the insertion site. So letter D is incorrect. And same as for letter B, the client should lie with the affected leg extended for 6 to 8 hours. So letter B is also incorrect. Now among the two choices, always remember that you as a nurse must not give any false assurance to the patient. Stating the client is recovering well gives false reassurance to a client who could be at risk if fluids are not taken in. So letter A is a big no-no. Now we are left with the final answer, which is, it is important to drink fluids after this procedure. I will bring you some water and I encourage you to drink. The contrast used in angiography is nephrotoxic. And the client should have adequate fluids after the procedure to eliminate the dye. So that's it. Now for the next question, a client undergoes ligation of varicose veins. The nurse includes in the plan of care which important interventions to address concerns with peripheral tissue perfusion. Select all that apply. Now for this question, it talks about a patient that undergoes ligation of varicose vein. Now let's start with letter A. Always remember that compression stocking exert pressure on the vein of the lower extremities, promoting venous return back to the heart. So, stockings are removed for at least an hour per day to allow for inspection and ensure blood flow through small superficial vessels. So, letter A is included. Now look at letter E. Sitting does not aid in venous return. So the client is encouraged to walk and lie down soon after surgery to enhance tissue perfusion. That's why letter E is included. Meanwhile, letter B, letter C, and letter D is not included because for letter B, flexing the extremities does not aid tissue perfusion, although it maintains joint range of motion. That is why letter B is not included. For letter C, numbness is a temporary or rarely permanent complication of surgery. Oh no! That's why letter C is not included. Meanwhile, the last one, letter D, briskly scrubbing the extremities will not aid tissue perfusion. That is why we are left with the final answer, which is letter A and letter E. So that's it. Okay, now let's go for the next question. A client's angiogram demonstrates the final stage of atherosclerosis. The nurse concludes that this client's pathophysiology includes which late development element. So this question talks about an angiogram showing the final stage of atherosclerosis. So among the 4 choices, what do you think demonstrates late developing element?
Oh no!
Now if you answered letter D, inflammation of the arterial wall, you are wrong because it occurs earlier in development of atherosclerosis. And also look at letter B. Fatty deposits in the intima occurs earlier in development of atherosclerosis, which is also on the same stage of letter D. So they are both eliminated. Now we are left with the 2 choices. If you answer letter C or lipoprotein accumulation,
Oh no!
you are actually wrong because in this phase, it occurs earlier in the development of atherosclerosis. That is why the final answer is letter A, which is the presence of atheromas. Always remember that the final stage of the atherosclerotic process is the development of atheromas, which are complex lesions consisting of lipids, fibrous tissue, collagen, calcium, cellular waste, and capillaries. The calcified lesions may rupture or ulcerate, stimulating thrombosis. That is why that is the final stage. Now let's proceed for the next question. When working with a client with peripheral arterial disease, the nurse assesses for which signs and symptoms that would be consistent with tissue ischemia. Select all that apply. So this question talks about the signs and symptoms of peripheral arterial disease that is consistent with tissue ischemia. So among the 5 given manifestations below, which among them is consistent with tissue ischemia? So let's start with letter A, the peripheral edema. If you included peripheral edema on your choices, you are actually wrong. Why? Because peripheral edema on the affected leg would be consistent with venous disease and not arterial disease. So that's why letter A is not included. Now look at letter B. If you included letter B on your choices, of course, you are correct. Because trophic changes from hypoxia and tissue malnutrition in PAD consist of thickened toenails, hair loss on the extremities, and thin shiny skin. So letter B is included. Now for letter C, leg pain, also called intermittent claudication, is a primary manifestation of peripheral arterial disease. Intermittent claudication is muscle pain caused by interruption in arterial flow, resulting in tissue hypoxia. That is why letter C is also included. Now look at letter D.
Oh no!
If you included letter D, you are actually wrong. Because brownish discoloration to the skin of the leg would be consistent with venous disease and not arterial disease. Because the one that is consistent with arterial disease is pale color skin and not brownish discoloration. So letter D is not included. Now for letter E, if you answered also letter E, you are actually correct. Because of insufficient blood supply, expected temperature of the skin of the affected extremity would be cooler than normal. So the final answer is letter B, C, and E. Now for the next question. In providing community education on prevention of peripheral arterial disease, the nurse should include which major risk factors? Select all that apply. So in this question, we will talk again about peripheral arterial disease. But this time, we will determine among the 5 choices below, what are the major risk factors? So what do you think the answers? So as usual, let's start with letter A, the dysarrhythmias. If you answered it you are actually wrong. Because the presence of these arrhythmias is not a risk factor for PAD. As well as letter B, the low protein intake, it is not a risk factor for PAD. Although hyperlipidemia from high fat intake or familial tendency is a risk factor. So letter B is not included. Now for letter C, exposure to cool weather is not a risk factor for PAD, although it could worsen the symptom when disease is already present. Now for the remaining two, if you answered both of them, you are actually correct. Because for letter D, cigarette smoking promotes vasoconstriction and is a major risk factor for PAD, while letter E, hypertension is a major risk factor for development of PAD. So that's it. That's the final answer. Now let's proceed for the last question.
Yeah!
When teaching a client with an aneurysm about signs and symptoms that may indicate impending rupture, the nurse first consider which client data.
Oh, come on.
So on this question, we are finding a data that indicates impending rupture of aneurysm. So among the four choices below, what do you think the answer? Now, if you think letter A is the first thing to consider, you are wrong. Because the medication the client is receiving is vague and is not directly related to risk of aneurysm rupture. So letter A is not included. While letter B, the blood pressure relates to whether the aneurysm may rupture, not to the associated signs and symptoms. That is why letter B is also wrong. Now, if you answered letter C, the age and gender of the client are unrelated to the signs and symptoms of aneurysm rupture. That is why we are left with a final answer, which is letter D. Aneurysm vary by size and location.
Yeah!
Signs of rupture depending on the location of the aneurysm. Dissection can occur anywhere, but most often occur in the ascending aorta, where pressure is the highest. So one thing that we must consider is the size and location of the aneurysm. So that's the final answer. That's it. And we're done with the part 1 of cardiovascular disorders. Now, if you want more videos about NLE or NCLEX, please do click the subscribe button.
No, sir!
And stay tuned for more videos. Thank you very much for watching, everyone. See you on my next video. Bye-bye!